The symptoms of an enlarged prostate can have a profound impact on a man's quality of life. They often start subtly but can become quite relentless. One of the most common signs is a frequent and urgent need to urinate. This isn't just during the day, it often continues through the night. Many men find themselves waking up 2, 3, or even more times every single night to use the bathroom. This constant interruption to sleep, known as nocturia, can lead to chronic fatigue, irritability, and a general feeling of being unwell during the day. It's hard to function at your best when your sleep is constantly broken. Beyond the frequent trips to the toilet, there are other frustrating symptoms. When a man with BPH tries to urinate, he might find it difficult to get started. This is called hesitancy. Once the stream begins, it might be weak or stop and start unexpectedly. It can feel as though the bladder isn't emptying completely, no matter how long you wait. This sensation of incomplete emptying is not just a feeling, it's often a reality. It can lead to a man needing to go to the toilet again just a short while after he has already been, creating a tiresome cycle. This condition can also create a sense of anxiety and social awkwardness. Imagine you're out with friends, at the cinema, or on a long car journey. The constant worry about where the nearest toilet is can be very stressful. Men might start to avoid social situations or limit their fluid intake, which isn't healthy. I met a man named John, a retired teacher, who told me he had to plan his entire day around toilet access. He stopped going on long walks with his wife, something they had always loved, because he was afraid of being caught short. It quietly shrinks your world. The consequences of ignoring BPH can be serious. If the bladder is consistently unable to empty itself properly, it can lead to complications. Stagnant urine can increase the risk of urinary tract infections, which can be painful and require antibiotics. In more severe cases, it can lead to bladder stones or even damage to the bladder and kidneys. In the most extreme situations, the urethra can become completely blocked, which is a medical emergency requiring immediate attention. This shows why it's so important to address the problem rather than just trying to live with it. So, what can we do about this? Traditional treatments range from medication to surgery, but there's a new and exciting area of research that holds incredible promise. This is stem cell therapy. The term might sound very futuristic and complex, but the basic idea is wonderfully simple. Think of stem cells as your body's own internal repair kit. They are special, unspecialized cells that have a remarkable ability. They can develop into many different types of cells that your body needs, such as muscle cells, blood cells, or brain cells. They are essentially blank slates, waiting for instructions. There are different types of stem cells, but the ones often used in these new therapies are called mesenchymal stem cells, or MSCs. We can get these cells from a person's own body, often from their bone marrow, or even more easily, from their own fat tissue. This is fantastic because it means we can use a patient's own cells to treat them. This greatly reduces the risk of the body rejecting the treatment. The magic of these stem cells lies in what they do once they are introduced to a damaged or inflamed area. They are naturally drawn to sites of injury or inflammation in the body. It's like they have a built-in homing signal. Once they arrive at their destination, they don't just sit there. They are incredibly active. They can release a whole cocktail of powerful substances, including growth factors and anti-inflammatory molecules. These substances help to calm down inflammation, encourage the existing cells to heal, and prevent further damage from occurring. So, in essence, stem cell therapy is about harnessing the body's natural healing powers and giving them a massive boost. We are not introducing a foreign drug or a synthetic chemical. We are using the body's own intelligent, versatile cells to orchestrate a repair process. The goal is to help the body heal itself from the inside out. Now, let's connect the dots. How can these clever stem cells help with an enlarged prostate? The latest research suggests they can tackle the problem in two main ways. Firstly, remember that BPH involves inflammation and the overgrowth of prostate tissue. When stem cells are carefully injected directly into the prostate gland, they get to work on that inflammation. Their powerful anti-inflammatory properties can help to calm the irritated tissue, reducing the swelling and discomfort from within. This is a key part of easing the pressure on the squeezed urethra. Secondly, and perhaps most excitingly, stem cells appear to have an ability to stop and maybe even reverse the excessive growth of cells. This is a process called apoptosis, which is basically programmed cell death. It's a natural and healthy process that our bodies use to get rid of old or unneeded cells. In BPH, this process doesn't work as well as it should, leading to a buildup of tissue. Stem cells seem to be able to send signals that tell these excess prostate cells it's time to go, helping the gland to shrink back towards a more normal size. Let's think back to our friend John, the retired teacher who had to plan his life around the toilet. In early clinical trials, men like John have undergone this therapy. For many of these men, the results have been very encouraging. Over the following weeks and months, they reported being able to sleep through the night again, having a stronger urine stream, and no longer feeling that constant, urgent need to go. Their lives started to open up again. This research represents a potential game changer for men's health. Current treatments like medication can have side effects such as dizziness or sexual problems. Surgery, while effective, comes with its own risks, like infection and a longer recovery time. Stem cell therapy offers the prospect of a minimally invasive procedure using a patient's own cells that could provide lasting relief without these drawbacks.